Good day, everyone. So today we're going to talk about the different types of aphasia. So the first one is the Broca's aphasia, which is the expressive non-fluent aphasia. In Broca's aphasia, individuals have difficulty producing speech. They often struggle to form complete sentences, speak slowly and laboriously, and may use short, fragmented phrases. However, comprehension and understanding of language typically remain intact. The next one is the Wernicke's aphasia, or receptive fluent aphasia. Wernicke's aphasia affects comprehension. Individuals may speak fluently in normal rhythm and syntax but produce nonsensical jargon-filled speech. They might be unaware of their language errors and have significant difficulty understanding spoken and written language. Next one will be crossed aphasia. It is a lesion to the right hemisphere causing language deficiency. It occurs in bilinguals and polyglots. Crossed aphasia is a rare condition where the language center in the brain, typically located in the left hemisphere, is damaged, causing language deficit. Despite the injury occurring in the right hemisphere, in most individuals, language functions are primarily housed in the left hemisphere, so it's more common for language problems to occur after damage to the left hemisphere or the left side of the brain. So the next one is the anomia aphasia. Anomic aphasia, often referred to as anomia, is a type of aphasia characterized by difficulty in recalling words or finding the right words while speaking or writing. People with anomic aphasia often have intact grammar and fluency but struggle with word retrieval. This can occur due to the various brain injuries such as stroke, traumatic brain injury, or degenerative neurological conditions like Alzheimer's disease. The specific areas of the brain responsible for word retrieval and lexical access are typically affected in anomic aphasia. So the next one is the global aphasia. Global aphasia is one of the most severe and profound forms of aphasia, resulting from extensive damage to large portions of the brain language areas, particularly affecting both Broca's area, which is responsible for speech production, and Wernicke's area, which is responsible for language comprehension. It is usually occurs due to the significant stroke or extensive brain injury affecting multiple language-related regions. Individuals with global aphasia experience profound difficulties in both expressive and receptive language skills, making communication extremely challenging. The next one is the agraphia. It is a language disorder that specifically affects a person's ability to write. It's often associated with aphasia, which is a broader language impairment usually caused by brain damage, such as a stroke, head injury, or neurological conditions. Next is the chronic aphasia. Chronic aphasia refers to the persistent language difficulties that persist over an extended period, typically beyond the acute phase following a brain injury. It is a long-term condition where language impairments such as difficulties in speaking, understanding, reading, or writing continue for an extended duration after the initial onset of the condition. Next, the conduction aphasia. Conduction aphasia is a type of language disorder characterized by difficulty in repeating words or phrases while having relatively intact abilities in language comprehension and speech production. It is typically caused by damage to the arcuate fasciculus, a neural pathway that connects Broca's area that is responsible for speech production and Wernicke's area that is responsible for language comprehension. Next one is the transcortical motor aphasia. Transcortical aphasia refers to the group of language disorders characterized by specific patterns of language impairment resulting from the brain damage, typically located in areas surrounding the main language center of the brain. This condition involves disruption in language abilities but retains certain preserved language functions despite the impairment. So in conclusion, each type of aphasia results from different areas of damage or dysfunction in the brain, leading to specific language deficit. Rehabilitation and therapy approaches also often vary based on the type of aphasia, focusing on strategies to improve language functions, communication, and quality of life for individuals affected by this condition.